One of the problems with lymphedema in the pelvic area at all, but particularly the genitals, is that it's so embarrassing to the people who suffer from it. We can do a lot of work to keep it under good control, but we can't get rid of it altogether. So it's a case of managing it, and they can come back to us when they need it. So we're just going to have a look where those problem areas are.
Okay.
So this gentleman, he's had cancer of the penis and in the pelvic area, so he needed surgery where he had lymph nodes removed of both groins, and then he had radiotherapy as well. We're looking at the right inner groin, that's become a bit more firm and tight, and then just to check what the swelling of the penis is like.
Okay.
He is extremely active, and for him the biggest prohibitor is the fact that his leg is so swollen and that his scrotum can sometimes swell to the extent he can't walk or sit. So this is quite firm compared to last time, and this is where you were saying the swelling's starting to come down. He has had liposuction of his leg, which has made a significant difference in terms of being able to wear normal trousers, normal shoes. He's been able to go back to his running. You were mentioning the cupping is helping to keep this soft.
It does, yeah.
Okay, so let's see how responsive it is. So we squeeze, we seal, and we're just going to slide it along, and we can change the pressure of the cup by giving it little squeezes as we go along. You're softer on the left than you are on the right, so you've obviously been focusing more of your attention on the left, which is the bigger problem area. How much time do you spend massaging these days?
45 minutes.
45 minutes. So it's very intensive on a self-management level. There we go. So that is responding really well. So definitely something to keep at. Okay. And then you were mentioning going to the toilet. That's been...
Yeah, it's always a problem. It's...
Yeah.
You're never quite sure which way you're going to direct the urine, to be honest with you.
Okay.
Depends how swollen everything is.
But that's got better since we first met.
Yeah. It's been 3 years now since I had an operation that kicked this all off. So we've had a pretty rough 3 years.
We were warned that he might get lymphedema. That's when I started going on the internet to actually find out about it. Now we've got the treatment, now we know what's happening, that's fine, but it was getting there was the bigger hurdle.
Everybody's an individual, they're going to deal with it their own way. For me, if I can't move, that tells on me. So as soon as I have a day where it swells up so tight that I can't bend my knee, that's when I start throwing the rattle out.
Getting help early on is really important to help you manage it as effectively as possible.
Our next patient is a gentleman who had prostate cancer.
I'd have to guide that one over. It had a radical prostatectomy. Then, of course, you have the problems with urinating and things like that, and wearing pads and changing pads because obviously you've got no real control. And then some of the lymph nodes had been taken out during my operation. The chemotherapy came along. I had swelling in the legs and then into the genital area, and the swelling was quite large.
The skin around that area is so soft and stretchy, so there's nothing to resist that swelling from just getting bigger and bigger. We had a gap of treatment last year because he was involved in a really bad car accident which broke his pelvis, so that has actually made his genital edema worse.
Bernard has a special name for the shorts he wears to control the swelling.
Ball crushers.
Yes, he actually said ball crushers.
Well, they're doing the job, aren't they? Lift and squeeze.
Getting them on is a bit of a, getting them in, getting them all snug as a bug in a rug sort of thing, but once they're on, they're okay.
Compression using snug shorts and bandages helps to manage swelling.
It was a bigger area, wasn't it? Yeah, and it was quite raised as well.
And also there are methods that we've been encouraged to try here. My wife is very good at doing it, obviously, because they need to be bandaged up.
So the bandaging overnight then obviously helps.
Yes, and it does bring it down.
Perfect. Okay, and then the shorts.
Confident and relaxed communication makes consultations easier for all.
So quite extensive swelling up the top as well, which is probably why the shorts are cutting in a bit.
Mm-hmm.
The tissues are nice and soft. can definitely feel it into your hip on that side as well.
Yeah, well, that is the worst side there.
Yeah, okay. So then skin, it's really healthy. I can see the bandaging is needed. Hey? It's soft, but you can feel it's full.
More, yeah, and it can be squeezed more.
Yeah. So for the penis itself, especially now if you're going to the toilet and you are finding that for whatever reason it's more swollen than usual, it's literally a matter of hold the penis and just gently squeeze it.
Squeeze.
Always making sure the thumb's at the tip so that the tip doesn't come out. And just gently squeeze it, and you'll find literally just doing that 10 times
We'll shift it,
soften it, and hopefully make it easier when you do wee.
If you've got a partner who can help, it can ease the self-management load. Jane is Bernard's wife.
So you're just pushing into the tummy, yeah, and then push this side as well, and you'll feel it's slightly firmer on this side.
Firmer.
So what I would do is probably do 20 on this side and 10 on that side. If you use the flat of your hand, it's more comfortable again because you're spreading the pressure.
There's a lot of things he can't do for himself, so like dressing, getting the compression wear on. He can't reach down to put the moisturising cream on and things. So, and the taping up at night is basically my job, because I don't think you'd be able to do it at all on your own.
For 60 odd years it was fantastic, and we were able to do what we wanted to do, and now
A little bit more
I'm
tight.
very, very lucky to have her.
The operation that Bernard had on his prostate can also affect the ability to pass urine. A solution, unlike moisturising or bandaging, is something you can only do yourself.
I have to say that if the pelvic floor exercises were to strengthen that area and to reduce the problems I was having with urinating, it has worked in most cases, apart from the fact that I think the lymphedema has caused me another little problem, having control over where the urinating goes.
Pelvic floor exercises would ideally become part of your daily routine. They can help reduce the swelling too. For extra help with the direction of your urine, try folding a hand towel long ways, like this. Sit on it and put pressure on for about 5 minutes just before you go to the loo. The edema often goes down enough to be able to pee a bit straighter.
Things, at times might seem hard and you might feel quite down about it, but then they do improve, so it goes in ups and downs.
Well, sex came to an end because of the radical prostatectomy. We still have a kiss and a cuddle. And a laugh. So.
We'd like to thank our contributors for taking part in this film. It's not an easy thing to talk about, but whether you're a patient or therapist looking for more information, the key message is early diagnosis and support can really help to manage symptoms.